On this edition of Independent Sources, Immigrant Healthcare Fight, the effort to get benefits for the city's undocumented immigrants.
People are able to get really important services, but they aren't always able to get all the services that they need.
And sparing a room, making it easier to find a roommate in New York City.
We're really keen on doing a quality service in New York and doing the market justice before we spread everywhere else.
Those stories and more coming up on Independent Sources. Welcome to Independent Sources, bringing you news from New York's ethnic and immigrant communities. I'm Pierre-Pierre. The New York Immigration Coalition and the Hastings Center have put forward recommendations to the mayor's office on how to address the lack of health care for the city's undocumented immigrants. The group's suggestions come after a report that they co-authored revealed that about 250,000 undocumented immigrants in New York City do not have health care benefits. Sarah Pizon spoke with Claudia Calhoun of the New York Immigration Coalition about why that's the case and some of the steps that can be taken to alleviate the situation.
Thanks for joining us, Claudia.
Thank you for having me.
So why is it that more than half of New York's undocumented immigrants don't have access to health insurance?
People who are undocumented are excluded from coverage through the Affordable Care Act, and that includes people who have deferred action for childhood arrival, or that's the President's Executive Order, DACA, which is what we sometimes call it. In New York City, there are institutions, healthcare institutions, that provide really important access to a lot of those populations, like the New York City Health and Hospitals Corporation, or HHC. And there's also federally qualified health centers that provide really wonderful, culturally competent services. But those organizations are dependent on financing that is sometimes not as much as what they need. And so one of the reasons that we've gotten involved in this work is to see what we can do to identify sustainable local solutions to make the coverage stronger and make the services stronger.
So what role does emergency Medicaid play in giving undocumented immigrants benefits?
Emergency Medicaid is so important. It provides coverage for care in an emergency situation, without which, like, there's a technical definition, but it really just means that someone, without that treatment, they would be in danger of dying or having bodily harm occur. And New York interprets this somewhat liberally because they provide coverage for things like chemotherapy and they provide dialysis. So that is really life-saving treatment. Some of what we know is that even with those really important services, that still leaves gaps in services that people need, like emergency Medicaid doesn't cover dialysis maintenance medications, and so and it doesn't cover organ transplants, and so people are able to get really important services, but they aren't always able to get all the services that they need. And so for that reason, we know that sometimes people may not be able to get care they need. They may suffer downturns in their health, or they may there's a risk of mortality and poor health outcomes for New York City healthcare residents.
Right. So let's talk a little bit about the other options besides emergency Medicare. Yeah. So what are the other options open or available for undocumented immigrants?
Well, like I was saying, HHC has many facilities throughout the city, and there are organizations like the Institute for Family Health or Urban Health Plan, which are federally qualified health centers which provide care sort of in neighborhoods. And then for certain in other facilities, people can get care that is paid for with emergency Medicaid, but they wouldn't necessarily be able to get all the services that they need. And so we tried, one of the things we do is really try to get the word out to immigrant communities about these different services. And then we also work with the facilities that are providing this care to try and make it better, try and make it more patient-friendly, try and make it more cohesive. And so that's one of the things we spent a lot of time thinking about, how the city can do that.
Right, and it's about raising awareness and also crossing, I guess, language barriers.
Language access is a huge issue. There are great protections for low English proficient consumers, but I think it's a question of working with healthcare providers to make sure they're providing interpretation all the time and in all the right moments, and making sure they have the resources to do that as well.
Right. So in your report, Undocumented Immigrants and Access to Healthcare in New York City, which you put together with the Hastings Center, you provide some recommendations for Mayor de Blasio.
Yeah.
One of them is the creation of medical homes. I'm sorry.
Yeah.
Can you explain what that is?
Yeah, a medical home, a primary care medical home is a place where people know that they can go to get services. It's where they know they're going to be able to get in and get seen with, like in a reasonable amount of time. And ideally, a primary care medical home is also going to coordinate with specialty care providers when that's needed and make sure that the patient doesn't fall through the cracks, make sure the patient is able to see a specialist when they need to, and then that they come back for routine care to help manage their chronic conditions.
And so what role do you see the municipal ID playing in providing this health care?
So the IDNYC is a really exciting program, and the New York Immigration Coalition advocated for a long time to see it happen, and we're just so excited about the success of its rollout. It is a potential vehicle to link someone to services. It doesn't have to be the IDNYC, but that is one existing program which could, like in the record of the ID, it could also have their primary care medical home, so they would sort of know and have some information about the importance of getting services, perhaps sort of through the IDNYC. It's a vehicle. A lot of people have signed up for them, and so it's a opportunity to get information about these services and about the importance of getting in to see a provider to people when they seek them.
Yeah. And so how are undocumented immigrants paying for these services? How does it work exactly?
Sure. So undocumented immigrants get health care through a lot of different ways. Some undocumented immigrants actually are able to get health insurance through their employers, but we know that they're probably in the minority. Some may pay out of pocket for services, and some may get bills for services that they receive, like particularly if it's in an emergency situation, and they may not know that they actually have protections in terms of New York state law and vulnerability to sort of medical debt. And so, and then, I mean, through places like HHC, they can also get sliding scale fees sort of applied to them. So they are, and HHC does a tremendous job at making really valuable health care accessible to people who are very low income. One of the challenges is making sure people know about these opportunities, and then one is making sure that when they get plugged in, that they are able to have continuity, go back when they need it, don't have to wait too long for appointments. And we're working with the Mayor's Task Force on Immigrant Health Access and with HHC on a number of different ways to really try and make all of that happen.
That's great. And what's been the feedback from your report?
It's been very positive. We've gotten lots and lots of good, really great congratulations and some interest in sort of writing more about it. So it's very exciting. What we really hope is that it will be a tool both for advocates and also for community-based organizations to use both in advocacy and also, in other cities, sort of thinking through how other municipalities can also do this work to expand access across the nation.
You've mentioned HHC a couple of times. Can you just explain exactly what that is and what it means?
Yeah, absolutely. HHC is New York City's Health and Hospital Corporation. It is New York City's public hospital system. It is, I think, the oldest public hospital system in the nation, and certainly the largest. And it has a long tradition of providing access and care to immigrant populations, and like hospitals like Bellevue and Elmhurst and Kings County are really like bulwarks of services in the communities that they serve. And so they're a really important partner in improving and tweaking and getting the word out about how people can get access services in New York City and any plan that might come out of the Mayor's Task Force.
That's great. Well, thanks for joining us.
Thank you for having me.
Still to come on the show, the business of finding a good roommate in New York. Before that, Abby Ishola and Sarah Pizon have some other news.
Thanks, Gary. Every week we ask you to tell us what's happening in your community. Here's what we gathered. Sarah, what's trending this week?
Advocates say Governor Cuomo's plan to end AIDS in New York by 2020 is underfunded.
How so?
So the governor said he would dedicate $10 million to the plan. He wants to diminish the rate of new HIV infections from 3,000 to 750 by 2020. But advocacy groups like Housing Works and Treatment Action Group have analyzed the numbers and say that it's actually going to cost billions of dollars. Wow. His plan alone would just cost more than $2.5 billion in Medicaid costs.
That's a lot of money.
It is, but if the plan is implemented, it would save $6.8 billion in Medicaid costs.
Wow. So the plan could potentially be groundbreaking.
Yeah.
The battle between developers and those against the redevelopment plan for Willets Point, Queens is a trending story once again. This time, State Senator Tony Avella and park advocates filed an appeal to halt plans for a mega mall in the area as part of the city's multi-billion-dollar redevelopment project.
Wow. So how do they plan to stop that part of the project?
Well, as you may know, the city wants to turn the area into commercial and retail space. People have been fighting that. A lot of people aren't backing down. So Senator Tony Avella and park advocates, they feel they have a legal reason to fight this because part of the mall, the mega mall that they're building, is going to be on park land. So they're using that as a way to get rid of this part of the project.
So what's next for them?
Well, back in August, Manhattan Supreme Court Judge Manuel Mendez dismissed their case, saying that, he believes that the redevelopment plan would be good for the area. So they're hoping that the justices that presided over this particular part of the case will understand where they're coming from and agree with what they're saying.
Well, good luck to them.
Absolutely.
Plans are underway for the second annual Flushing Street Fair Festival.
Who's hosting the event?
Well, it's members of the Flushing Business Improvement District that are organizing this year. Last year, they had 46 booths, and this year they hope to double the number of booths. Wow. And the goal for this event really is to get people to come and enjoy Flushing and discover what it's all about. There's about 100,000 commuters every day that go through in and out of Flushing, and they really want people to, come in and check out what the area has to offer.
Nice. Food and culture, that's always great. When is the event?
Well, the event is taking place in August, so make sure you add that to your summer to-do list.
Will do. A Mexico native is promoting literacy among fellow Mexicans in New York City by setting up a community lending library of books in Spanish.
So what exactly is a community lending library?
Well, basically, a community lending library is when, the community pulls together books and they share them amongst themselves. So the man, Lautaro, who's actually organizing the library, says there's a shortage of Spanish bookstores, and he feels that, Mexicans, it's hard for them to get to the public libraries because they work such long hours. So he feels that this will help that situation.
So how do they plan on operating this?
Well, the bookshelves will be placed in 3 people's homes in the Bronx and Queens. Cool. So people can go there and, take some of the books and bring them back. And to reach members of the community, he has joined the Mexicans in New York City Facebook group, and they have over 3,000 members.
Wow, that's really cool.
Yeah, he's off to a good start.
Awesome. That's it for this week. Be sure to tweet us at IndieSources, #Abby and Sarah.
And tell us what's buzzing in your community.
Thanks for staying tuned. Finding an affordable apartment in New York is hard. Finding a mate who will share the rent with you can be even harder. That's where the company called SpareRoom wants to come in. The site posts listings and hosts meetups for potential roomies who need help with the vetting process. Sarah Pizon spoke with the company's communications director, Matt Hutchison, via Skype.
Matt, thanks for joining us today.
Thanks for having me.
So tell us, what is SpareRoom about? How does it work?
It's about people. I think a lot of people think about apartment sharing sites as being about the real estate. And actually, if you're going to live with other people, it's all about the people. So it's about helping people find somebody to share.
And how does it work exactly? What's the concept like?
It's really simple. You can either people match themselves up, so you can search by neighbourhood, you can search by budget, you can search by a whole host of things, and help people find each other, really.
And so how are you different than Airbnb or, say, Craigslist?
I think the difference between Airbnb is they definitely go for the kind of the holiday market and people visiting town from elsewhere. Well, we're definitely about the residential thing. It's about living with roommates and sharing apartments. And the difference with Craigslist is just the amount of detail and the experience. Craigslist does everything. We do one thing and we do it really well. And it's about rooms, it's about roommates, it's about helping people find the right match.
So what prompted you to create this company in the first place?
We've been doing SpareRoom in the UK since 2004, And just our experience in New York tells us it's exactly the same kind of city as London is. It's busy, it's hectic, it's expensive, spaces are a premium, and it's really hard to find somewhere affordable to live. And it's a city very much like London in those ways.
And so when did you bring your company over to the New York side?
Came to New York 2012 and started SpareRoom and also our speed roommating events.
And so what do you mean by roommating your events? Like, tell us about the events themselves.
Yeah, we run events called speed roommating where you can turn up either looking for a room or looking for people to share with. And it's just a chance for people to meet each other and to make their choice about who they're going to live with rather than where they're going to live. Because apartment and neighbourhood and budget and those things are all really important. But if you're going to spend a year living with somebody, who that person is and how well you go is going to make or break the experience.
Right, absolutely. And so for New York, like, what are usually the price range that people look for? What's the most common price range you usually see?
Everybody's always looking for a bargain, and you know, for example, the average rent for a room in a shared apartment in Manhattan is now something like $1,400 a month. That's a lot of money. So people are always looking below that, and even in Brooklyn, you know, the average is something like $1,200 now. So it's cheap, and people are always trying to find something for a bit less than that and trying to find a bargain, and it's getting harder and harder.
Absolutely. And I read that now it's not just people looking for roommates, it's also couples looking for roommates, people that just tied the knots, right?
Yeah, absolutely. And you think that when people, you know, get married and settle down, they would go off and live their own life. And increasingly, people can't necessarily afford to do that. And so they're finding themselves sharing with other people, sometimes with other couples, just to help make ends meet. And
so who usually comes to your events besides, I guess now, we know couples and students, but what do you see? What kind of variety of people do you see?
Professionals is mostly what you'd expect as people in their 20s and in their 30s. And it is young professionals rather than students mostly. But we do see people of all ages. You know, the first event we ran, the first guy turned up was 62.
And so what's next for SpareRoom in the U.S.?
We're looking at other cities, but I think New York is just such a key focus for us now because it's that kind of iconic city, like London, where people move to the city from all over the world, all over the country. And that first experience of renting and who you live with can make or break kind of your New York story. So we're really keen on doing a quality service in New York and doing the market justice before we spread everywhere else.
Great. Well, thank you so much for being with us, Matt.
Thank you.
When we come back, telling the story of some of the first Spanish immigrants in Lower Manhattan. Finally, from us, our film focus zooms in on the documentary called Little Spain. That was the area near the west end of 14th Street in Lower Manhattan, where Puerto Ricans, Spaniards, and other Spanish speakers settled during the 1800s. The area has been called the first attempt of a successful Hispanic immigration process to the United States. Abby Ishola spoke to the film's director, Arthur Balder.
We'll start by watching a clip of your film, Little Spain. Arthur, in your documentary, you explained that Little Spain was located in Lower Manhattan from the 1800s until its decline in the 1980s. What was the area like?
Well, what happens is that there are a couple of mass migration from Spain, from the middle 19th century, and then there is a new wave during the Spanish Civil War, and in between there is a big movement also of Spanish immigration. Of course, Spanish immigration in America is just one drop in the proverbial bucket, but still it's an interesting story behind.
So why doesn't it exist anymore? What happened to the neighborhood?
Well, this is a very interesting question. What happened is that the Spanish immigration, as many others, was a success, and they moved to other areas. They did not keep their positions on 40th Street in the area where they were basically located.
And when I heard about the film, I thought Little Spain had never heard about the neighborhood. Why do so few people know about this neighborhood that existed?
First of all, because it's already disappeared. Yeah. And second, maybe because there was not a big interest by many people who was studying the Spanish immigration in the city until the last 10 years. So that's why it's like a kind of new discovery.
Really? So why do you feel it's important to spread the word about this neighborhood that existed?
I think it's interesting because every single spot in New York, and specifically in Manhattan, has history. And it's very interesting that we can discover still places that have so much to tell that we cannot imagine. Yeah? So it's history of New York, and history of New York is always interesting for the audience, I think. Also, it's interesting for the Spanish audience because they are discovering that there was a whole story going on with their immigration chapter in the United States. And they are part of the immigration in the United States.
And for those who haven't seen the film, what can they expect to see? How are you depicting the neighborhood in your film?
Well, I think the most important in a documentary of that type is the documentary evidence. And the documentary evidence is there, exposed in the documentary. The film is based on maybe like 3 important points. One is the old pictures that were taken beginning of the 20th century until the 70s. Those pictures are the most strong evidence that Little Spain was there, that Little Spain has had a street festival as Little Italy had, which was called Santiago Apostol because that was the patron of many Spanish immigrants who came from Galicia. And I think that's probably the basis of the documentary. The second point is the testimonies, and the testimonies are the most important were all people who can tell how was Little Spain in the 70s when they arrived into the country.
Okay. And how have people responded to your film so far?
I think the critics have responded very well. Probably the most difficult was to deal with the Spanish press. The problem is that there is a lot of corruption in many chapters of today's Spain, and also in the journalistic level.
Wow.
Yeah.
So did they push back against the film?
Not they. It's just that we had a couple of problems which cannot be considered as a whole. But yes, we had a problem. Specifically, we had problems with the national news agencies and with the national TV of Spain. Why? Because there is not a strong practice of what we have to call journalistic integrity, and that's a big problem. Yeah. So I don't want to get into details, but I think that was the most difficult part of the project because it caused a lot of time and energy, almost 4 years of work.
Wow.
And probably that came from a part of the people who wanted to be present in the film and who I decided not to be present in the film. But independent filmmaking is that, and there is no money coming from Spanish government or other Spanish agencies for the realization of the film. So.
Wow. So going back to Little Spain, is there any part of it that's been preserved?
Not that much, no. I mean, probably the most interesting part of Little Spain that has been preserved is the architecture of Our Lady of Guadalupe. That was the first church in the city that gave service in Spanish.
Wow.
At the beginning of the 19th century. No, at the beginning of 20th century. And so that's probably the most interesting part that remains there. It still is closed because it was translated into 1 block away to another parish called Our Lady of Guadalupe at Saint Bernard, which was originally Irish origin temple.
Okay. So what's next for the film?
Yes, we have a couple of film festivals, especially one in Spain. I cannot say which one because they have their own tempos, But I think it will be very interesting because it will be the moment where the Spanish audience will be able to evaluate there in their own country the film.
Okay. So how can people here see the film?
Well, here in the United States, there is the possibility of acquisition. It's for sale in DVD. Only here in the United States by the moment.
Okay, on your website, I assume?
On the website of the company that is making the distribution, yeah. SpanishAmericanSociety.org.
Okay. Thank you so much, Arthur, for being on the show.
Thank you. Thank you so much.
That's our show this week. Thanks for staying tuned. Till next time, be independent-minded.